The fluorescent light above Triage Bay 3 has been flickering for 11 days, and the nursing supervisor has filed 2 work orders about it that have disappeared into the same institutional void that swallows everything that doesn't fit on a spreadsheet. The flicker runs at a 60 Hz cycle, which means it strobes at a rate the human eye flattens into steady illumination. Unless you're 64 years old and you've spent 31 of those years learning to read the spaces between steady things. At 4:47 a.m., the flicker throws a microshadow across the clipboard of a charge nurse named Whitney, who is currently counting to 50 under her breath. She has been trying to time Dr. Alan Reynolds' arrival for 9 years and has still not accepted that he arrives when he decides to arrive, regardless of how many 50 counts she sells herself. The clipboard catches light and throws it back. The clipboard has a list on it, the patient assignments for the night shift, typed in a font that looks professional, but is actually too small to read at the distance Whitney holds it, which is the distance that prevents her from admitting she needs reading glasses. Sarah Chen reads it from across the nurse's station without moving her head. She has been a nurse at St. Anthony's Memorial in Northeast Philadelphia for 19 years. She was a nurse at the 28th Combat Support Hospital in Mosul for 4 years before that. She was, before that, a Special Forces Medical Sergeant, Operational Detachment 1812, the unit that didn't have a name anyone outside the unit was cleared to know for 8 years before that. She held the rank of Sergeant First Class. Her DD-214 lists 7 deployments. Her medical file lists no injuries, which is the most damning kind of file a person can carry. She holds no rank now. She holds a stethoscope and a patient assignment list with 17 names on it, the longest of which begins with the surname Okonkwo and ends in a potassium value of 2.9 that no one on this shift has noticed on a board designed by people who do not look at boards. Sarah is 64. Her hair is steel gray and cut short in the style that nurses' unions do not officially recommend, but have stopped attempting to police. She wears reading glasses that are slightly stronger than she needs, because the difference between perfect vision and slightly imperfect vision is the difference between being asked for help and being left alone. Her scrubs are the muted blue-green that fluorescents flatten into gray, and her nursing shoes are the kind sold in uniform catalogs for people who spend 12 hours on concrete. The shoes have no logo. The shoes have been replaced twice. She chooses them by hand because she does not trust that her feet have stopped making decisions about her that her mind has not yet authorized her to override. At 4:48 a.m., the emergency entrance doors open and 2 paramedics walk in with a patient on a stretcher. The patient is a man in his mid-30s, large, perspiring, with a hand pressed to his right side. The paramedics walk the way paramedics walk when they are about to say something they have already rehearsed, which is to say, calmly, with their weight balanced slightly forward, the body language of people who need you to receive what they are carrying before they can put it down. 42-year-old male, the lead paramedic says. Right flank pain, hypotensive, hasn't moved off his couch in 3 days. We brought him in for sepsis workup. His colleague adds, he says his wife's out of town. Sarah knows what that sentence is. She has heard it in Mosul in a different dialect. She has heard it in Baghdad under a different flag. She has heard it in 23 states in the backs of ambulances whose drivers did not say it but whose eyes did. The sentence is a piece of tape that has been placed over a sealed door in a house where something has gone wrong. She looks at the patient. She does not move toward him. First, she reads the stretcher, the angle of his back, the rhythm of his chest, the color of his lips, the way his hand is gripping his flank, and only then does she raise a hand to receive the chart. The hand is steady. Her pulse is 68. She has not done anything with her pulse. She has not trained it. 68 has simply been the pulse she has carried for 41 years, which is itself a clue she has stopped giving anyone. Dr. Alan Reynolds arrives at 4:51 a.m. He walks the way chief surgeons walk in hospitals where the chief surgeon has decided he is the most important person in them, shoulders slightly elevated, chin tilted a degree above horizontal, eyes moving across the nursing station the way a searchlight moves across a field. He has been chief of surgery for 6 years. He was a competent surgeon for the years before that. The competence is no longer the thing he leads with. What's the board look like, Whitney? Whitney holds the clipboard up the why she has held it up for 9 years, high enough that he cannot read it, in a pose that suggests she has already read it and is now waiting for him to ask her to read it again. 17 patients, she says. Bay 4 is holding, Bay 7 is empty. Bay 9 has been empty since last Tuesday, but we still can't get maintenance to confirm the suction is functional. Reynolds does not hear the second sentence. Reynolds only hears the first sentence and the first item of the second sentence, which is the only sentence that contains any information he has decided to uptake. Bay 9 is fine, he says. Bay 9 is always fine. Who do we have on intake? 42-year-old male, right flank, Whitney says. Nurse Chen is on him. Reynolds looks across the nurse's station, which is to say he looks 2 degrees to the left of where Sarah Chen is standing, because Reynolds has spent 3 years training himself not to look directly at anyone who might respond to him by saying something that requires him to listen. Nurse Chen, get the sepsis workup moving. Draw a lactate, start 2 large-bore IVs, broad-spectrum antibiotics within the hour. Lactate and blood culture before the antibiotics. He has not looked at the patient. Dr. Reynolds, Sarah's voice is calm, the patient's MAP is 62. The MAP, mean arterial pressure, is the number you get when you average the systolic and diastolic pressures and weight the diastolic twice, because the heart spends more of its cycle in diastole. Sarah learned this at 17, in a Special Forces selection course, in a muddy field at Fort Bragg, where the medic who taught her was a former Vietnam dust-off pilot who said the MAP was the number that decided whether a casualty lived through the next 10 minutes or didn't. The number you cannot see on a monitor. The number the monitor pretends to be a number. She has said the MAP out loud, in the tone she uses when she says a number out loud, which is a tone that does not contain a request, an instruction, a suggestion, or any other grammatical device that would permit Reynolds to convert it into one. Reynolds gives her a look that is not a look but a calculation. The calculation is, if I respond to this, I will, for a single second, admit that a nurse has read a number that I have not personally seen on a monitor. The calculation takes approximately 1 second. The calculation produces the following output. 2 large-bore IVs and the sepsis bundle, Reynolds says. I'll be at the desk if the patient's tanking. He does not say the second sentence with concern. He says the second sentence with the vocal placement of someone establishing who will be first informed if there is a problem, which is itself a confession that he has not informed himself yet. Sarah nods once. She does not say thank you. Thank you is for people who have given you something. Reynolds has reminded her of an order she was already executing. She moves to Bay 9. Bay 9, she now notes, with the suction apparatus that has been flagged unconfirmed since Tuesday, which means the bay cannot be used for any patient whose airway she may be required to secure, which means the bay is a bay that cannot hold certain kinds of emergencies, which means the bay is, in her internal classification system, a bay she will not put anyone in if she can possibly avoid it. She does not say this. She moves the patient to Bay 4. If you enjoyed this story, subscribe. We publish a new one every week. The patient in Bay 4 is named Marcus Webb. Sarah does not learn this for another 9 minutes, because medical charts at St. Anthony's require a level 4 identification check that no one performs for the first 45 minutes after a patient is wheeled in, during which the patient is referred to by the bed number, which has the unintentionally clarifying effect of turning people into the rooms they are lying in. Marcus Webb is a freight dispatcher. He is 6'3", 280 pounds, and has spent the last 3 days lying on a couch because his wife was out of town, and the couch had a blanket on it, and the blanket was the softest thing in his house, and his flank had started hurting on a Tuesday, and he had decided on a Wednesday that Tuesday would resolve itself, and on a Thursday that Wednesday would have. And by Friday the couch had absorbed him the way couches absorb people who have stopped asking for help. He has not eaten in 60 hours. His urine is the color of a copper pipe that has been left in the sun. His flank pain is the kind of pain that has stopped being pain and started being a piece of information. Sarah Chen stands at the foot of his bed. She reads him the way she has been trained to read people, which is the way that a combat medic reads a casualty, which is the way that a dog reads a hallway. Marcus Webb is not a casualty. He is a patient. The reading is the same reading. She has been told several times in her career that the Adangs are different readings. She has not found this to be technically accurate. Mr. Webb, she says, I'm Sarah, I'm going to help you. Can you tell me where the pain is? Marcus Webb does not answer for several seconds. He is looking at her face. Most patients look at her hands because nurses' hands are the medical instruments they know to look at. Marcus Webb is looking at her face. He has looked at her face because something in her face has registered as a face that has already asked the question he is about to be asked. "My right side," he says. "Around the back like a kidney stone, but worse." Sarah nods. She reaches for his wrist. She does not need the pulse. She can see it in his neck, where the carotid artery is rising and falling with a rhythm that is not the rhythm of a healthy heart. The rhythm is a rhythm she has felt in 3 different countries. The rhythm is the rhythm of an organ that has decided to begin its slow withdrawal from the project of keeping its owner alive. She puts 2 fingers on his wrist because that is what nurses do, and what nurses do is the way a nurse remains a nurse, and what remains a nurse remains teaching other people that the way remains the way. She notes the rhythm without writing it down. She has been taught to write things down. She writes things down when other people are watching. When she is alone, she trusts the rhythm to stay where she put it. "Mr. Webb, I'm going to put an IV in your left arm, and I'm going to draw some blood. I'm going to give you a liter of saline. I'm going to give you an antibiotic. And then Dr. Reynolds is going to come talk to you." She does not say the 5th thing she is going to do, which is to read his abdomen with her hands. In a way, the ED doctors have not been trained to read abdomens with their hands. She looks at his flank. The flank is the side of the body between the ribs and the hip, and it is the place where the kidneys live, and it is the place where a perforated viscus, a hole in some part of the digestive tract, releases the contents of the digestive tract into the abdominal cavity, where the contents begin to do the work of destroying the cavity. She has seen perforated viscus in the field. She has diagnosed perforated viscus in a Humvee at 2 in the morning on a road outside Fallujah. She is going to diagnose perforated viscus here, with a hand and a stethoscope, and a patient whose eyes are looking at her because his eyes have decided they can stop looking for help elsewhere. She puts a stethoscope on his abdomen. She listens for 4 seconds. She moves the stethoscope. She listens for 4 seconds. She does not hear bowel sounds. The absence of bowel sounds is, in her profession, what the specialists call an ominous finding, which is a phrase that means the bowel has stopped performing the function the bowel is supposed to perform. She does not say this. She says, "I'll be back in a moment, Mr. Webb. We are going to take good care of you." The 3rd sentence in that group is not a courtesy. It is a death sentence someone is going to read for her. She does not know this yet. She suspects this. She has spent 41 years suspecting things and not saying them and being correct about most of them, which is itself a piece of information she has decided not to expose. She walks back to the nurse's station. She puts a piece of paper in front of Whitney. Whitney looks at the piece of paper. Whitney has worked at St. Anthony's for 11 years. Whitney has worked at St. Anthony's for 11 years the way a person works at a job they have confused with a position they have confused with a rank, which is to say, Whitney has invested 11 years of her life in becoming the person who decides how the nursing station is organized, and any disruption to that organization is, in Whitney's internal accounting, a disruption to Whitney. "What is this?" Whitney says. The question is not a question. The question is a small door that Whitney has placed in front of Sarah so that Sarah can crawl through it. "Marcus Webb has a perforated viscus," Sarah says. "I need a CT surgeon on standby. I need a laparotomy tray set up. I need Dr. Reynolds to look at him, not the desk." Whitney looks at Sarah. Whitney is 43 years old. Whitney does not have a perforated viscus. Whitney has a sheet of paper from a 64-year-old nurse that contains a diagnosis Whitney did not write. Whitney calculates the cost of receiving this piece of paper and decides to articulate the cost. "You don't order laparotomy trays," Whitney says. "That's a doctor's order, that's a doctor's call." "I am aware," Sarah says. "I am asking you to call Dr. Reynolds because his phone keeps ringing out to his desk and he keeps not answering it. He will answer it if you call and tell him I have a surgical abdomen." "I am aware," Sarah says again, because she has decided to use the same sentence twice to demonstrate she has not run out of R. Repetitions, "I am asking." The 2 sentences are not equivalent. The first sentence is a fact. The second sentence is a request. Sarah has used the structure of a request because requests are the things nurses do, and Sarah is a nurse, and Sarah has spent 19 years at St. Anthony's learning to do requests the way requests are done, which is the way a person stays a nurse in a place where being a nurse is sometimes not what is being asked of her. Whitney picks up the piece of paper. Whitney does not pick it up the way nurses pick up the paper that contains the diagnosis that will determine whether their patient dies of a hole in his colon. Whitney picks it up the way a piece of evidence is picked up at a place where evidence is being collected. "I'll pass it along," Whitney says. Whitney does not say this with the tone of a person who is going to pass it along. Sarah walks back to Bay 4. She begins the IV. She draws the blood. She hangs the saline. She gives the antibiotic. She does not give the second antibiotic, which is the one that should be given for an intra-abdominal infection, because the order for the second antibiotic has not been written by anyone who writes orders. She does not write the order herself, because she is a nurse, and she has been a nurse for 19 years, and she has decided she will continue to be a nurse for as long as she can be a nurse without writing the order she is qualified to write. She adjusts Marcus Webb's blanket. She is not adjusting the blanket. She is taking his pulse with her hand on his wrist under the blanket. The pulse is 128. The pulse is the pulse of a man whose heart is doing the work of a heart that has been asked to compensate for a circulatory system that is failing him in increments. At 5:09 a.m., Whitney walks back to the nurse's station and says, "Dr. Reynolds says Bay 4 is a sepsis workup, not a surgical consult, and you should run the sepsis bundle as ordered." The sentence is a sentence. The sentence is also a transfer of risk. The transfer of risk is, if Marcus Webb dies, the transfer of risk is the transfer of risk from Dr. Reynolds to Sarah Chen, because Sarah Chen is the person who said the diagnosis, and Dr. Reynolds is the person who said the sepsis bundle, and the sepsis bundle is a thing that exists on a piece of paper that has been signed by a doctor. If you're new to the channel, tap the bell. We drop a new story every Thursday night. Sarah nods. She says, "Thank you, Whitney, I have heard you." She does not say it to Whitney. She says it to the room. The room does not respond to her. The room has been trained by Whitney not to respond to nurses. At 5:34 a.m., Whitney returns to the nurse's station for a different reason. Whitney's step has changed. Whitney's step is a step that contains information Whitney has decided she will be receiving several times tonight, the first of which has just been received. Whitney says, "Mr. Webb in Bay 4, his BP is 88/52. Reynolds has been called." The sentence is not about Reynolds being called. The sentence is about Whitney being able to say that Reynolds has been called. Whitney has spent the last 25 minutes placing a phone call to Reynolds in which she has, for the first time in her career, used the word perforated. Because the word perforated is the only word that Reynolds has decided he will respond to, and Whitney has decided she will pass through his door for the first time in 9 years, because the door is now a door she can also blame him for not opening. Sarah does not answer. Sarah is already moving. The move is not the move of a nurse answering a code. The move is the move of a person whose body has been doing a different job for 41 years and has decided in this moment that the different job is the job. She has been trained to walk. She walks the way nurses walk at St. Anthony's, quickly, but not so quickly that anyone could accuse her of running. The walk is a performance of the kind of urgency that has been deemed appropriate for a 64-year-old nurse whose patient has become unstable. The walk is not the walk she is performing. The walk she is performing is the walk she was trained to perform in an extraction lane under contact in Mosul in 2007. The walk is the walk of a medic crossing 20 meters of open ground to a casualty, in which every meter is a meter that could be the last one, and in which the body does not lean forward, does not speed up, does not signal anything that could be read by anyone standing on the other side of the glass. The body moves at a pace that is consistent. The body is consistent because consistency is the only thing that cannot be disrupted. She arrives at Bay 4. Marcus Webb is breathing 28 times a minute. 28 is the breathing rate of a person whose body has decided to compensate for a thing the body cannot compensate for, which is a hole in his colon, which is dumping the contents of his colon into a part of his body that was, until 72 hours ago, sealed. The compensation will work for a while. The compensation will not work for long. She can hear him breathing from across the room. The breathing has a sound. The sound is the sound of air moving past obstruction, and the obstruction is the sound of a body that has begun to drown in the fluid of its own septic contents. She has heard this breathing before. She has heard this breathing in a warehouse in Ramadi. She has heard this breathing in a field hospital in Balad. She has heard this breathing in a hotel hallway in Karachi. The breathing is a sound her body has decided, 3 decades into her career, that it is no longer in the business of being surprised by. She stands at the foot of his bed. She says, "Mr. Webb, stay with me." She knows what "stay with me" means. She knows what it does to the autonomic nervous system of a person who has been told to stay with them. She has used this sentence 3,000 times. She has used this sentence on battlefields, in ICUs, in the back of helicopters. She has used this sentence as a sentence. She has used this sentence as a tool. She has used this sentence as a tool because she has discovered 3,000 times that the sentence moves a chemical inside the body of the person it is said to. And the chemical is the chemical that, for a brief window, can hold a dying body in the place where the body is alive. The chemical is adrenaline. The sentence is a tourniquet applied to the patient's morale. Her left hand is on the side of his face. She does not know her left hand is on the side of his face. Her hand is not her hand. Her hand is the hand of a medic. Her hand has done this. Her hand has touched the side of the face of a soldier named Davis in a Humvee at the edge of a field in Mosul. And the soldier's eyes had been closed. And the soldier's eyes had opened when the hand touched his face. Because the hand had been trained to touch faces in a way that the face does not forget, even when the soldier cannot remember his name. Marcus Webb's eyes open. The eyes are the eyes of a person who has been looking at a different room for some time. The room he has been looking at has not contained Sarah, but the room he is now looking at does, and the room he is now looking at is the room that is going to contain him for the rest of his life. "Marcus," she says, "I'm Sarah, stay with me." Her right hand is on the side rail of his bed. The side rail has not been moved. The side rail has been touched by her right hand. The right hand is not a hand that touches side rails. The right hand has done something else for 41 years. The right hand has held the tracheostomy hook of a soldier whose throat had been crushed. The right hand has held the chest tube of a soldier whose lung had collapsed. The right hand has held the needle that has decompressed the chest of a soldier whose heart had been pushed out of place. The right hand is not a hand that touches side rails. The right hand is a hand that has been waiting for 19 years for the side rail to be something a hand like that can touch. She presses the side rail button. The side rail lowers. She begins the conversion of Bay 4 into a bay that is, for the duration of this crisis, a casualty collection point. She is not performing the conversion consciously. The conversion is happening because it is the conversion that has happened hundreds of times in the bodies of medics who have been told that the situation they are in is the situation they are in. She moves the IV poles to either side of the bed. She positions the IV poles for an extraction because the IV poles are the only vertical obstructions in the bay, and the IV poles are, in the vocabulary she has retained from a vocabulary she no longer uses, the things that hold the line open. She has not said this to anyone. She does not know she is moving the IV poles. The IV poles have been moved. She moves the oxygen tank to the head of the bed. She has done this in Mosul. She moved the oxygen tank to the head of the bed in Mosul because the oxygen tank is a thing that can be rolled, and the rolling of an oxygen tank is sometimes the difference between a person staying in a room and a person not staying in a room. She does not know she is doing this. She is doing this. She looks at Marcus Webb. Marcus Webb has stopped compensating. Marcus Webb is the patient she has been trained to look for, the patient who looks fine, the patient whose eyes are wide, the patient whose panic has begun to produce the chemicals that have begun to kill him faster than the infection that has begun to kill him, the patient who is 16 minutes from a respiratory arrest that will be irreversible. She has seen this patient. She has seen this patient at the 28th CSH, on a Sunday, in a tent whose temperature was 122 degrees at 3 in the afternoon, and the patient had been a 23-year-old Marine whose colon had been perforated by a piece of shrapnel that had been the size of a fingernail clasp, and the Marine had been 18 minutes from a respiratory arrest that would have been irreversible, and Sarah Chen had walked into the tent and said 3 things in a row, and the Marine was still alive 11 years later because the 3 things had been the right 3 things at the time they had been the right 3 things. Dr. Reynolds walks into Bay 4. Dr. Reynolds walks into Bay 4 the way Dr. Reynolds walks into rooms Dr. Reynolds has been summoned to, which is, in this hospital, a walk Dr. Reynolds is now performing for the 3rd time in 9 years. Dr. Reynolds' walk is a walk that conveys the information that Dr. Reynolds is arriving at the room because Dr. Reynolds was called, not because the patient required him, which is the information Dr. Reynolds has communicated for 9 years. In every walk he has performed into any room he has been called into. "Nurse Chen," Reynolds says, The patient is septic. The bundle is running. Coordinate with respiratory for the BiPAP, and I'll write for vasopressors if we don't turn around. He does not say the third thing he should have said, which is, and let's get surgery on the phone. I'm going to perform a surgical airway, Sarah Chen says. On the floor now. The sentence is in past continuous tense. Sarah Chen's sentences have not been in past continuous tense at St. Anthony's for 19 years. Sarah Chen's sentences have been in past simple. Sarah Chen's sentences have been in past simple because past simple is the tense that does not invite response, and Sarah Chen has spent 19 years not inviting response. The sentence is in past continuous because the action has already begun. Reynolds says, "Nurse, you don't." The rest of the sentence does not arrive. Sarah Chen has already turned the oxygen tank on. Sarah Chen has already placed Marcus Webb in the supine position. Sarah Chen has already extended his neck with a folded towel that Whitney has placed, for 25 cents per folded towel, on every trauma stretcher at St. Anthony's for 11 years, and that nobody has ever explained the purpose of, because the purpose is not information that an emergency department is in the business of distributing. She palpates the cricothyroid membrane, the small, soft spot between the thyroid cartilage and the cricoid cartilage in the front of the throat. In a surgical airway, a cricothyrotomy, the membrane is the place where a small incision is made. Then a tube is inserted through the incision directly into the trachea, bypassing the mouth and upper airway. She has performed a cricothyrotomy by flashlight, in a Humvee, on a soldier whose face had been destroyed by an IED. She has performed a cricothyrotomy with a kitchen knife, in a field hospital, on a Marine whose face had been destroyed by a piece of asphalt from a roadside bomb. She has never performed a cricothyrotomy in a hospital. She has been trained to perform a cricothyrotomy in a hospital, and trained to perform a cricothyrotomy out of a hospital, and has decided over 41 years that the training is one training. She picks up a number 11 blade from the suture tray that Whitney has not set up, but that Whitney has, in fact, set up, because Whitney has, at some point, learned to set up trays for patients who are not going to need trays. Because Whitney has been a nurse long enough to know that patients who are going to need trays have always been, in some moment, patients who have looked like patients who are not going to need trays. The tray that is set up is the tray that Sarah Chen picks up. She makes the incision. The incision is 2 centimeters vertical, then 1 centimeter horizontal through the membrane, the standard surgical airway technique taught to combat medics and emergency physicians. The incision is a small, warm opening in the front of Marcus Webb's neck. This content is for entertainment purposes only. It is not medical advice. Please do not attempt any of the procedures described without proper training. She inserts the tracheostomy hook. The hook holds the incision open. She picks up the size 6 cuff tracheostomy tube. She inserts the tube. She connects the bag. She begins to bag Marcus Webb through the new tube. Marcus Webb is breathing through a hole in his neck. Marcus Webb is alive. Whitney is breathing the way Whitney breathes when something has happened that Whitney did not have a position on, which is a rate of approximately 32 breaths per minute, which is a rate that does not help. Sarah does not look at Whitney. Sarah bagging a patient through a new surgical airway is not looking at Whitney. Sarah is bagging a patient through a new surgical airway with her hand on a bag valve mask, which is a self-inflating bag attached to a tube and a mask, used to push air into a patient's lungs manually when the patient cannot breathe for themselves. The bag is squeezed once every 5 seconds. The bag has been squeezed at this rate by Sarah's hand approximately 60,000 times in her career. He's going to Sarah says to Reynolds, now. Reynolds has not been listening to Sarah. Reynolds has been calculating the position of his name relative to the medical record of what Sarah Chen just did. Reynolds has a procedure note that requires Reynolds to be the author of the note, and Reynolds has a procedure that was performed by a nurse in Reynolds' department in front of Reynolds' face, and the procedure has now been performed in a way that does not permit Reynolds to claim to have performed the procedure. I'll write the note, Reynolds says. The note becomes a note about what Dr. Alan Reynolds did. The note does not say what Sarah Chen did. The note says, across its 5 paragraphs, that the chief of surgery arrived at the bedside and found the patient in extremis and immediately performed an emergent surgical airway. The note uses the word performed. The note uses the phrase in extremis, which is the medical term for the patient was actively dying as the doctor arrived. The note has, in its 2nd paragraph, a sentence that says, I, Dr. Alan Reynolds, performed the procedure. The note contains, in its fourth paragraph, a sentence that says the procedure was performed without complication. The note does not say who held the oxygen tank. The note does not say who palpated the membrane. The note does not say who made the incision. Sarah Chen is in the note, in the page. Sarah Chen is named in the operative note as a witness. Dr. Reynolds gives Sarah a look. The look is a look that is being delivered to a witness, because witnesses are people who have seen things, and people who have seen things have the capacity to describe what they have seen in conversations that Reynolds is not present for, which is something Reynolds has decided is the only reason a witness exists. You did well, Reynolds says. Stay close. The second sentence is a sentence that Reynolds has delivered 3 times in his career, and one of those times has been to Sarah Chen. The first time was a Tuesday, 6 months ago, for an IV placement that Sarah Chen had performed in 11 seconds on a patient of Reynolds whose veins were the veins Reynolds had personally failed twice. The second sentence is the sentence Reynolds gives to people he has decided he is now required to retain. The second sentence is not a sentence of praise. The second sentence is a sentence that converts Sarah Chen's name, on Reynolds' internal personnel list, from a nurse who can be rotated between bays to a nurse who must be present for procedures Reynolds intends to claim. Sarah nods the way she nods. At 6:02 a.m., Whitney walks past Sarah Chen on her way to the supply closet. Whitney does not speak. Whitney does not speak because Whitney has decided that speaking to Sarah Chen in this moment would require Whitney to integrate information Whitney has decided she will not integrate. Whitney has decided to keep the information in a separate place where it cannot contaminate her position. If this story moved you, even a little, tap the heart below. It tells us what to write next. Marcus Webb is rolled to the OR at 6:11 a.m. He is alive. The surgeon, who has been called at 6:04 by a charge nurse who has been a charge nurse for 11 years and has decided, for the first time, to call a surgeon before being asked to call a surgeon, performs the laparotomy. The laparotomy finds a perforated diverticulum in the sigmoid colon. The sigmoid colon is the S-shaped final section of the large bowel. A perforated diverticulum is a small, weakened pouch in the wall of the colon that has burst open. The patient is repaired. The patient will be in the hospital for 9 days. The patient will go home. The patient will go back to a couch that no longer has the same weight it had a week ago. Sarah Chen does not leave the bedside until the patient is rolled down the hallway. Sarah Chen has not been required by any hospital protocol to stay at the bedside. Sarah Chen has stayed at the bedside because the bedside is the place where she is permitted to be, and being permitted to be at the bedside is, in this hospital, the only permission she has ever been granted. She walks back to the nurse's station. She picks up the chart she was reading at 5:09 a.m. when Marcus Webb's BP first dropped. The chart is for a patient named Okonkwo. The chart is a chart whose potassium value is 2.9 and whose potassium value is a potassium value that no one on the shift has yet caught. The 2.9 is the 2.9 of a patient whose cardiac rhythm is the cardiac rhythm of a patient whose potassium is not where cardiac rhythms require potassium to be for cardiac rhythms to remain stable. The TW. 0.9 is the 2.9 of a patient named Okonkwo, whose EKG is the kind of EKG that has begun to suggest that the patient's potassium has been falling in a way the patient's body has begun to compensate for, and the compensation has begun to fail. Sarah Chen does the calculation. The calculation is 100 kilograms at 2.9 potassium, replacing to 4.0 over 8 hours, divided by the rate of infusion of the potassium chloride solution she is about to hang. Sarah Chen hangs the solution. Sarah Chen adjusts the drip. Sarah Chen writes the note. Sarah Chen does this with a hand that has done this, but the hand has also, in this same hour, performed a cricothyrotomy that will, in some sense, never be hers. Sarah Chen has been a nurse for 19 years. Sarah Chen has been a nurse the way nurses are nurses, which is to say she has done the work the nurses do, and she has done the work the doctors don't do, which is the work of being the body's witness. Sarah Chen has been the witness to 19 years of work that has not been claimed, and whose claim in 19 years has occasionally made her the recipient of the second sentence Reynolds has decided to give to people like her. The sun has risen over Philadelphia, which is to say, the sun has risen over the Schuylkill Expressway, which is to say, the sun has risen over the buildings the hospital has been built next to, which is to say, The sun has risen over a part of the city that contains a 24-hour pharmacy, 2 diners, a bus stop where a woman in scrubs is waiting, an emergency department whose charges are about to change, and one piece of news. The piece of news is that a man named Marcus Webb is going to live. The piece of news is that a nurse named Sarah Chen performed a procedure that no nurse at St. Anthony's Memorial has performed in 11 years, and that no nurse has the authority to perform in this state without the supervision of a physician. The piece of news is that no physician supervised Sarah Chen. The piece of news is that Dr. Alan Reynolds has decided that the piece of news will not be news. Sarah Chen has decided that the piece of news will also not be news. Sarah Chen has decided this because Sarah Chen has decided this for 41 years, and the decisions have not been decisions, and the news has not been news, because the news would, in fact, have been a piece of information that would have moved her from a place where she can do what she did to a place where she cannot. And the place where she cannot is the place she has been in for 41 years, which is the place that she is permitted to be in, which is the place that is the place she has chosen to remain in. Sarah Chen does not consider herself a hero. Sarah Chen considers herself a nurse. Sarah Chen has considered herself a nurse for 19 years and a combat medic for the years before that, because Sarah Chen has decided that the two roles are the same role, which is the role of a person who is permitted to be at the bedside when other people are not permitted to be at the bedside. She does the math on the next patient. She is already doing the math on the next patient. At 6:28 a.m., the emergency department's glass double doors open, and a man walks in. The man is 60 years old. The man's posture is the posture of a person who has been issued a uniform for 30 of his years, and is wearing civilian clothes for the first time in long enough that the civilian clothes have begun to behave like civilian clothes. The man is wearing cargo pants. The man is wearing a leather jacket. The man is wearing steel-toed boots that have been polished to the shine that steel-toed boots acquire when they have spent their life being polished by the same pair of hands. The man is wearing a baseball cap with no logo. The man's hands are at his sides. The man's hands are the hands of a man who has been deployed to 12 countries in a unit whose name he has not been told, and whose name has not been told to him so many times that he has begun, in retirement, to read the name on coffee cups that have no other information on them. The man's name is Sergeant Major Harold Vance, retired. Vance has been at St. Anthony's for the last 3 hours, sitting in the waiting area, beside a vending machine that does not dispense the kind of coffee he prefers, because the only coffee the vending machine dispenses is the coffee that has been selected by a committee that has never had to drink coffee at 3 in the morning for 30 years. Vance has been at St. Anthony's because Marcus Webb is Vance's sister's son. Vance is not here for the coffee. Vance is here for a piece of information that has been circulating through a small network of people who are connected to each other by something that no civilian institution would recognize as a connection. The network is the network of people who were, in their working years, members of the same special operations command, which is also the network of people who have all, in some way, signed paperwork that has prohibited them from describing the network in any context that is not the network itself. The piece of information that has been circulating through the network is the piece of information that Sarah Chen is alive. Sarah Chen did not know that the network was still tracking her. Sarah Chen had assumed, in the years since her retirement from the unit, that the network was the kind of network that retires. Vance walks into the ED. Vance does not look at the ED the way a civilian walks into an ED. Vance reads the ED. Vance reads the ED the way he was trained to read every room he has ever walked into, which is to say Vance reads the doorways first, then the corners, then the people, then he finds the person he has been sent to find. Vance looks at the nurse's station. Vance looks at Whitney. Vance does not look at Whitney the way civilians look at nurses. Vance looks at Whitney, and he reads Whitney, and he reads Whitney in 0.6 seconds, and concludes that Whitney is the woman who has been in charge of the room since the room has been in charge of itself, and Vance concludes that Whitney is not the woman he is here for. Vance looks past Whitney. Vance sees Sarah Chen. Vance recognizes Sarah Chen in the way that people recognize other people who have done the work Vance has done. The recognition is not facial. The recognition is postural. The recognition is the recognition of a body that has been trained to absorb pressure without altering its internal state. Sarah Chen's body is doing the thing it was trained to do, which is to be a body that does not change when conditions change around it. Vance is not a person who responds to recognition with recognition. Vance has been retired for 9 years. Vance has been trained in his working years to give recognition in the way recognition is given in his working years, which is a way that has been formalized into a gesture that has not been performed in this ED since the ED has been an ED. Vance walks toward Sarah Chen. Vance does not say, "Excuse me." Vance does not say, "Ma'am." Vance walks toward her the way senior NCOs walk toward people they have decided to honor. The walk is a walk that has been observed before in other rooms in other years. Vance stops 6 feet from Sarah Chen. Vance puts his hands at his sides. Vance brings his right hand up to the brim of his baseball cap in the motion that has, since 1775 in the United States military, been the motion of salute. Vance salutes Sarah Chen in an emergency department waiting area in Philadelphia on a Tuesday morning, with his right hand at the brim of his baseball cap and his eyes on hers, and his body held in the posture that the body holds when the body has been told, by a piece of information the body has retained, that the person the body is saluting is the person the body is saluting. The waiting area contains, at this moment, 11 people. 3 of those people are veterans, all 3 of them notice. In the United States Army, when a retiring veteran enters a room, any enlisted person present of any rank, of any age, retired or active, is obligated by custom to come to attention. The 3 veterans stand. The first veteran is a man in his 70s, wearing a Johnny-come-lately jacket that has not yet been embroidered, whose left hand goes to his forehead in the gesture that is the gesture of the salute. The second veteran is a woman in her 40s wearing a hoodie, whose right hand goes to her temple in the same gesture. The third veteran is a man in his 50s wearing a Yankees cap, who stands up the way men in their 50s who have been in the Army stand up when they have decided the situation has been decided, which is to say, slowly and completely. Whitney reads the room. Whitney, for the first time in 9 years, reads a room she has not placed herself in the center of. Whitney does not know what to do with the room. Whitney has been trained in 11 years of working at St. Anthony's to read rooms that contain nurses and doctors and to place Whitney in the center of the room Whitney has read. The room Whitney is now reading does not contain nurses and doctors. The room contains veterans. The veterans have, in Whitney's reading, placed themselves in the center of the room. Whitney realizes that the salute is for Sarah Chen. Sarah Chen is not returning the salute. Sarah Chen is the only person in the room who is not moving, which is, in a tradition she has been trained in since she was 17, the correct posture for the recipient of a salute from an equal, which is the posture that says the salute is recognized, and the recognition is shared, and the recognition is not a thing that needs to be performed because the recognition has been performed by the person who has delivered it. In the United States Army, when a retiring veteran is honored by a salute, the retiring veteran returns the salute. Sarah Chen retrieves the salute from a part of herself that has not been touched in 19 years. Sarah Chen's right hand rises. Her hand rises the way her hand has been taught to rise. The hand goes to the level of her eyebrow with her fingers extended and joined, her palm facing slightly downward and slightly outward, her upper arm parallel to the ground. The hand holds for 2 seconds. The hand holds for 2 seconds because 2 seconds is the duration that conveys in the United States Army that the respect being delivered has been received. Sarah Chen returns the salute from a nurse's station at St. Anthony's Memorial Hospital on a Tuesday morning in front of 11 people, in front of a charge nurse who has just watched something she does not have a category for, in front of 3 veterans who have just delivered something the charge nurse has not been trained to recognize. Sarah Chen returns the salute in the way Sarah Chen was trained to return salutes, which is to say, with restraint, without enthusiasm, with the understanding that the salute is the receipt of an acknowledgement that any other acknowledgement would have been inadequate to convey. Vance nods. Vance lowers his hand. "Sarah," he says, "the name is not a name. The name is, in the vocabulary Vance has retained from the vocabulary he has not used in 9 years, the name of a person who has been touched, by him, in a way that is permitted only between people who have shared, in some way, the experience of being touched by similar things." The veterans sit down. Whitney does not move. Reynolds has not seen the salute. Reynolds has been in the charting room, which is the room Reynolds uses for the kind of work that produces notes that say, "I, Dr. Alan Reynolds, performed the procedure." Sarah Chen lowers her hand. At 6:34 a.m., Sarah Chen returns to the bay she was assigned at the beginning of the shift. The bay has a patient. The patient has a chart. The chart has 17 pieces of information. Sarah Chen reads the 17th piece. The 17th piece is, Mr. Webb arrived at 4:48 a.m. in septic shock from a perforated sigmoid diverticulum. An emergent surgical airway was performed at 5:34 a.m. The patient is now in stable condition and has been taken to the OR. The note has not been written by Sarah Chen. There is no further information in the bay. There is no further information in the waiting area. There is no further information in the nurse's station. There is no further information that Sarah Chen has decided she needs. The chart has a chart, and the chart has 17 pieces of information, and the 17th piece is the piece that has just been performed by Dr. Alan Reynolds. Sarah Chen does not correct the chart. Sarah Chen has never corrected a chart. Correcting a chart is correcting the name of the person who has performed the work, which is correcting the work, which is correcting the decision of the institution that has decided the work will be performed by the person whose name is on the chart. Sarah Chen does not feel the absence of the correction. Sarah Chen has felt the absence of many corrections in 19 years, and the first absence taught her that the absence is not a thing she has the energy to repair. She picks up the chart for Okonkwo. The chart says the potassium is 4.1. The chart has been corrected by Sarah Chen's drip in the last 40 minutes. The chart has been corrected because Sarah Chen has decided in 19 years that some corrections can be made with drips, and some corrections must be made with procedures performed by people whose names are on charts, and Sarah Chen has decided to make the corrections she can make. If this moved you, if this was the story you didn't know you needed tonight, share it with someone. Quiet professionals don't surface often. They surface even less here. She reads Okonkwo's EKG. The EKG has begun to flatten. The flatten is the flatten of an EKG whose chemistry has been corrected, whose potassium is the potassium of a heart that has been resting in the right place for the right amount of time. Okonkwo is going to be all right. Okonkwo is going to be all right because Sarah Chen saw the 2.9, and Sarah Chen has been seeing things that other people have not been seeing for 19 years. Whitney walks back to the nurse's station. Whitney has spent the last few minutes in a state that has not had a name she can identify, which is a state Whitney has replaced, in her normal coping structure, with the behavior of walking in a straight line to a destination she has already identified. Sarah, Whitney says, the first name is the first name Whitney has used all shift. Dr. Reynolds wants the chart from Bay 4 back to the desk for review. Sarah nods. She does not ask what chart. She knows what chart. She hands it back. The chart has 17 pieces of information and the 17th pie. S is a piece of information that has Sarah Chen's hands in it, and Sarah Chen's name is not in it. Sarah Chen walked into the ED at 11:00 p.m. last night. She will walk out at 7:15 a.m. this morning. She will walk out with her patient assignment list, which she has reduced to 16 names after Marcus Webb has gone to OR. She will walk out with 9 hours of work that have not produced any of the recognition she has spent 41 years performing in the recognition of. She will walk out the same way she walked in. Her reading glasses will be on her face. Her scrubs will be muted blue-green. Her shoes will be unmarked. Her hand will be at her side. Her hand has been at her side for 19 years. Outside, the sun has begun to fall over the Schuylkill Expressway. The light has begun to fall in the way light falls when it is going through a stage of being light the city has not yet decided what to do with. The light has been falling in this way for 41 years. The light will continue to fall in this way for as long as Sarah Chen decides to keep walking home.